Ethics 34, the 4 types of medical errors. In medicine, we aim for perfection, but errors are a reality. As healthcare professionals, understanding the difference between medical errors is crucial for patient safety. Let's break down the 4 key categories you need to know for your boards and your practice. 1. Sentinel event definition. An unexpected occurrence involving death or serious physical or psychological injury. It requires immediate investigation and response. The case: a patient is scheduled for a bilateral knee replacement. Due to a communication breakdown, the surgical team proceeds to perform the operation on the wrong knee. The patient suffers permanent injury. This is a sentinel event. It demands a root cause analysis (RCA) to ensure this system failure never repeats. 2. Adverse event definition. An injury resulting from medical intervention rather than the patient's underlying condition. The case: a patient is admitted for pneumonia. The physician orders a common antibiotic, but fails to check the patient's chart, which clearly states a severe allergy to that specific drug. The patient receives the dose and goes into anaphylactic shock. The patient survives, but the harm caused by the medical management, the anaphylaxis, is classified as an adverse event. 3. Near-miss close call. Definition: an error that reaches the patient but causes no harm, or an error that is caught before it reaches the patient. The case: a nurse is preparing to administer an insulin dose. She realizes right before injection that the syringe was meant for a different patient in the same room. She catches the error, stops, and informs the team. The patient was not harmed, but the near miss exposes a critical flaw in the labeling system that must be fixed. 4. Never event definition. An egregious, highly preventable, and serious error that should never happen in a healthcare setting. The case: a patient undergoes abdominal surgery. 2 weeks later, they return with severe pain and infection. An X-ray reveals a surgical sponge was left inside the abdominal cavity. This is a never event. It is a catastrophic failure of standard protocols, such as surgical count procedures, that should be impossible in a safe system